In this webinar, we will learn about the rational use of antenatal corticosteroids. Before we talk about antenatal corticosteroids, let us also have a look at the major problems these preterm infants face. First of them is the respiratory distress syndrome, followed by increased susceptibility to infections, intraventricular hemorrhage, necrotizing enterocolitis, patent ductus arteriosus, bronchopulmonary dysplasia, etc. Out of these, RDS, IVH, NEC, PDA and infections have been known to be reduced either in their incidence or severity by the use of antenatal steroids. Antenatal steroids have following effects on the neonate. There is almost 45% reduction in the incidence of RDS, 46% reduction in intraventricular hemorrhage, 54% reduction in necrotizing enterocolitis and 31% reduction in the overall mortality. The current recommendations for our country is to give a single course of injection dexamethasone to be administered to women with preterm labor, that is between 24 and 34 weeks of gestation, at all levels of health care in the public as well as private sector. As per the current recommendations, administration of antenatal corticosteroid constitutes an integral part of standard treatment in preterm labor, irrespective of the place of delivery or the time of delivery. What we need to know is that oral preparation of steroids are not to be used. Repeated courses or more frequent doses are actually not useful, they might be harmful. Multiple courses in fact could have harmful neurodevelopmental effects on the baby. Antenatal corticosteroids have a role even if surfactant replacement is available with us. The preparations that are made available by the Government of India is injection dexamethasone sodium phosphate, available in the strength as 4 milligram per ml as a 5 ml vial. We need to administer total number of 4 injections which are 12 hours apart, and the route of administration is deep intramuscular. The preferred site is anterolateral aspect of thigh. Complete course is actually total of 4 doses which constitutes 24 milligram of dexamethasone. It needs to be administered using a 2 ml disposable syringe along with either a 22 gauge or a 23 gauge needle. And the good thing about this preparation is that it does not need to be refrigerated for storage, it can be just stored in an almirah. Let us now look at what are the indications for antenatal steroid use. Well, all women who are at high risk of preterm delivery between 24 and 34 weeks of gestation and who are in true preterm labor need to be administered a single course of dexamethasone. In addition, in the following situations that lead to imminent delivery, antenatal steroids should be administered. The first of them is antepartum hemorrhage, followed by preterm premature rupture of membranes, severe preeclampsia. These are the situations where we must consider using antenatal corticosteroids. So, then we also need to know which women should not receive antenatal steroids, as it may be detrimental to the woman herself or to her fetus. First of them is clinical, or rather the only contraindication is clinical chorioamnionitis, which is evidenced by history of fever and lower abdominal pain. On maternal examination, there is foul smelling vaginal discharge, tachycardia and uterine tenderness along with fetal tachycardia. So, this is a contraindication to the use of antenatal corticosteroid. Apart from that, situations like premature rupture of membranes, preeclampsia, hypertension and diabetes are not, I repeat, are not contraindication to the use of antenatal steroids. In all these situations, the obstetrician needs to monitor the pregnant woman's blood sugar and her blood pressure more meticulously after administration of antenatal corticosteroids. We must also know when do we expect the best effect of antenatal corticosteroid? So, antenatal corticosteroid therapy has maximal effect if the fetus is delivered 24 hours after the last dose and up to 7 days thereafter. So, friends, what have we learnt in this? What we have learnt is that antenatal steroids induce lung maturity in preterm fetus. What is required is a single course of antenatal corticosteroids which can reduce neonatal morbidities, including neonatal mortality to a significant extent. What is the drug of choice? It is dexamethasone, which is the drug of choice to women with preterm labor between 24 and 34 weeks of gestation. Thank you.